Hello, I'm here today to address one of the questions that came through the website, and that was, how do I help an adolescent family member dealing with a drug addiction? And it's a question I'd like to answer kind of in two parts. One is short term, and the other is long term. Short term, the most important thing is to make sure you find a way to get the person away from the drug use behavior. So if they're actively using on a steady pace, you probably might need to seek something like a residential treatment facility or even a brief hospitalization to make sure the person is detoxified well and away from that behavior. Otherwise, it's hard to start new behaviors that are going to be healthy. Some of that can be done on an outpatient basis, but there are treatment facilities for adolescents that also would be available to help with that process. So that would be the short term, and I think the goal there is not just to isolate and to let things take over from there on their own. There are important aspects to keep in mind for the longer term. One is the biology of the person, the adolescent at that point. The brain is a very vulnerable state during adolescence. Therefore, we really would have to think about the time it would take for the brain to reshape itself after the effects of the drugs that were used. Also with that, you really want to think about what things would be helpful to start rescripting the person's life. One thing that's going to be important to understand is whether there were any learning disabilities that might be going on, because this could be difficult and potentially a barrier for a person in the adolescent phase to learn new behaviors. So part of the treatment in the outpatient or even in the inpatient phase could include characterization of what type of learning disabilities there may have been. And then another piece that's very important, not only for adolescents, but for all persons with drug use disorders, is social support. In adolescents, it's more unique because they have not had the chance to build a large social support as most adults would have. Therefore, a lot of that might circle around the circle of friends that might be in school or other environments where the adolescent is on a regular basis, and also the family. I think a lot of times the circle of friends is focused on, and that could be very straightforward in terms of going into new environments and more healthy activities. However, the family is also a very important piece that should be addressed if that is an area of concern. Oftentimes that could include making sure the family themselves have support for whatever issues they may have going on, counseling, and even support groups for folks who have other children in drug use disorder behaviors. Things like Al-Anon and NAMI may be helpful there. And in certain cases, family therapy would also be helpful in order to mend some of the relationships. Not making that the forefront of treatment, but just recognizing that given social support is such an important factor in recovery, that mending that family relationship would be helpful also. So again, this is a short-term and a long-term approach, but I think using that approach would allow the adolescent in this case to get away from the behavior that they're in and also build a solid foundation to start new behaviors that could help maintain their abstinence long-term.